Karen Custer, PTA, is the founding director of START, which is an acronym for Stroke Active Recovery Therapy, an intensive therapeutic and recovery program for stroke and neuro injury survivors. Over 5 years, Karen has worked with over 100 survivors of stroke and neurological injuries, helping them to recover not only from their physical daily activities, but also to have a fulfilling life. And isn't that the key? I mean, it's one thing to be healed, but to have a fulfilling life post-healing. She's created a program that integrates intense physical therapy with social and cognitive skills that have enabled survivors to go from wheelchair-bound to skiing and, believe it or not, driving cars and just about everything else. Karen has more than 20 years of fitness and wellness experience in that industry, and she has served in all aspects from training to rehabilitation. Previously, she was a program director of one of the nation's largest rehabilitation services and stroke day programs for the Easter Seals, that is, of Colorado. And additionally, she has worked as a physical therapist assistant and outpatient rehab, treating patients with neurological and orthopedic diagnoses, as well as utilizing various manual approaches. So there you go, providing us a real-life example, though, of stroke recovery. That's why we're anxious to hear. And would you please welcome Karen Custer. Karen.
Well, thank you so much for having me. What a privilege to be up here and an honor to share with you. And Wayne, thank you for asking me to be here. As you said, Steve, I have had 20 years of wellness and fitness, and gosh, that kind of makes me old. One of the things that I am so passionate about is stroke survivors and their recovery. Not just the stroke survivors and their strokes, but their actual recovery. So I started out as a personal trainer years ago. I worked with paraplegics and quadriplegics and stroke survivors. And then I started saying, I need to have more, I need to do more. So I went on and furthered my education in physical therapy. And I was going to stay in the outpatient athletic training field forever until I started working with stroke survivors and realized, oh my gosh, the brain is so wonderful and how it regenerates, and I just fell in love with the people that I got to work with, and it was such an honor to be with them. So over the last 5 years, I've learned that the brain does regenerate. Wayne asked me at one point, what do I do? What's my methodology? And it's like, so I had to come up with some examples, and I'll introduce you to my clients a little bit later. But one of the things that I wanted people to understand is that once the clients leave their rehabilitation, they go home, they don't have anything else to do when they get home. So then what happens? They don't get better, they get worse. Their income drops, they get depressed, and they lose their hope. So when I started working at this day program, when I started working with these guys, we were doing a day-to-day, very unchallenging maintenance type activities, which was great. They had fun. There was a social interaction going on. But I was standing there watching their exercising, and I thought, oh, this is so boring. And if it's boring for me, it's got to be boring for them. So I decided we had to change some things around. So just for a moment, though, I'd like you just to imagine, just for a moment, you're getting up in the morning and you are getting ready for work or going to play golf on a weekend, and you try to get your arm in a sleeve, and it doesn't go there. And you look down, your hand's there, but it's not moving. And all of a sudden, you're calling out for help to your spouse or whoever's in the household, and you're trying to explain that you need help, but the words aren't coming out. They're just not there, not available. And then go forward a month or 2 or 3, and you wake up from a possible coma, and you realize you can't get up, you can't even sit up, but once you do sit up, you can't stand. Once you stand, you realize you can't walk, you can't even go to the bathroom by yourself. And then part of the worst thing that stroke survivors have to deal with, and that you could imagine doing, is you're trying to say something and you can't. Or they're asking you all these questions and you're going, I hear their voices, but I don't understand a word they say. So that's the reality for stroke survivors and their caregivers. And then imagine, after all of that, you're being told this is as good as you're going to get. So I'd like to introduce you to Tony. He's one of my clients. Tony survived a stroke. He was only 54. He owned a business and he was a carpenter. And here's his story. Start talking.
Hi, my name is Tony Cherry. I am 58 years old and had my stroke at 54. When I woke up from it, my neurologist asked me to move several of my extremities. When I was unable to, he told me that that was as good as I was going to get. Now, mind you, nothing moved. And now, mind you, also, this is a doctor, and I told him, bullshit, you don't know who I am, and this is not going to, I'm not going to be like this for the rest of my life.
So that's Tony. So just imagine you're being told the best you're going to do is between now, the next 6 months and a year, and that's as good as you're going to get. Obviously, Tony didn't agree with that, as you heard. But what you got to understand is that stroke survivors' bodies are not broken. They are not broken, it's just their brain is not communicating. So I believe that every stroke survivor can recover and rebuild their lives. And the reason I believe that is because if we give them an opportunity, give them a chance, and give them a structure, they can also recover their movement, their cognitive, and their speech. And I believe one of the biggest things we need to give them to recover is motivation and hope. Those are the biggest things. So when Wayne asked me, what do? I don't really have a methodology. The things I do know that we do that do work. One of the things we've learned is that hard work, number one, but the hard work comes when I give them a positioning that they need to be in, a correct position. We put them in the position, make them move it. We do it over and over again. I give them tactile feedback, and then we visualize and we do it over and over and over and over again. It's a repeat it again, repeat it again. They tell me it takes 10,000 repetitions to create a pattern. That's a lot. So this is where we work hard. This is part of pictures of my studio. We work hard. They come in for 5 hours a day. We do everything from speech to exercise to reading to writing to spelling to whatever it is that their goals are that they're trying to achieve. And along with that, we do have a little bit of fun. These guys love to laugh, and I loved what Karen was saying up here about the humor. These guys have the greatest sense of humor. It's fun to listen to them talk to each other and communicate. So I'm going to introduce you to some of my clients. We talked about putting them in a position, making them do the movement, visualize it, tactile feedback. So this is Dave. Dave actually was a CEO of multiple family restaurants. He suffered a stroke about 5 years ago. When I first met him about 5 years ago, his main goals were to ski and to drive. There was no other thing that he had to say. I want to ski and I want to drive. So I told him, okay, fine, skiing we can do. So we trained modified ski training that I would have done as a personal trainer. And I got to tell you, that man fought for 3 months, and in 3 months he went skiing. So for those of you who could imagine skiing on one leg and one arm, and the other leg doesn't really follow along, and you got to ski back here. So the third time he went skiing, he came into the program with a broken arm. Of course, we're all horrified, and I kind of looked at it and said, yeah, but you did it doing something you loved. And he thought that was awesome, because he said, yeah, I did. I did something I love. So here what we're doing is he came to me about 3 months ago and said, I want to run. I want to jog. And I said, okay, all things are possible. So I said, let's practice. And so we worked for about 3 weeks of me crawling on the floor, holding his toes up, as you can see there. And then making him walk as quick as he could while I'm trying to hold his toes up. We did this for about 3 weeks, and I sent him home with an assignment and said, I need you to go home and I need you to practice this. Take your shoes and socks off, practice, 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 and then come back to me and we're going to practice some more. And over the course of 3 weeks' time, he came in with this big smile on his face, and I said, what's up? And he says, watch. He took his shoes and socks off, and he walked without assistance, without any railing, and he walked perfectly normal. So we've been working very hard at him continuing that perfectly normal walk when he walks his 2 miles around a park every day. So one of the things I really work with on the clients is that we need to look at their potential, not their deficits. Because we all know what their deficit is. They have one side that doesn't function normally, got it. But what is your potential? And a lot of the speakers today have been talking about that we look at what is possible. Not what is, but what is possible. So this is Don. Don happens to be left-hand dominant, for his benefit. However, any activities you do, you need both hands. And one of the things that he has left behind and was not able to do for a while was to go fishing. Well, obviously you need 2 hands to fish. So he came to me and said, I want to go fishing again. I said, okay, well, we've got to get your hands functioning. I said, you can sit on the boat, but you got to have your hands going. So one of the things, again, we talked about the positioning. So we worked on picking these cones up. So this is Don and his initial attempt. Notice his tremors. So he's working on a grip, and stroke survivors, they can grip really hard, but letting go is really tough. So we're working with him on trying to relax his arm and his shoulder. So he practiced this probably 30 to 40 times in the course of maybe 45 minutes. And this is his ending result. No tremor. So when people tell me that these guys can't or won't, I completely disagree, because this is what I get to see. And what's funny is you don't hear the audio here. Says, okay, that's just enough of that. So Don also had come to me a few years ago when Dave and I were working together. He says, well, I want to ski. I have skis at home. I would like to do that. And I said, fine, join us. So Don also has been skiing. He hasn't been for the last couple of years, but he did ski the first year, and he went 3 or 4 times up to Winter Park to ski. And I'm real proud of him, because that takes a lot of energy, and also it takes away that fear factor. He was very nervous to get up on that ski slope with those slippery things on their feet and go down the hill. And this is Tina. I met Tina many years ago, about 5 years ago, when she first started in the day program, and she happens to be here today. Thank you, Tina. She's here to bless me with her presence. So when Tina came to me, Tina actually suffered a stroke and then multiple mini strokes after that, after having a dissection. She had a vertebral artery dissection and a ventricle dissection, and she suffered a stroke and then multiple strokes after that. And she's got one of the most positive, upbeat attitudes I've ever seen. She came to me and said, I just want my independence back. I would love to drive, because she had a Corvette. And it's classy. So again, I can help you with the independence. And so the staff and I worked with her tirelessly, trying to get her to the point where she could get her independence back, because at the time she was living in her brother's basement. And as you know, stroke survivors probably have a lot more trouble getting up and down stairs. When you go up 12 stairs, that's a lot. So she didn't spend a lot of time upstairs unless someone was there to help her get there. So we worked on stairs, we worked on standing, we worked on all the activities that she would need to become independent. And about 6 months to 8 months later, she came to me and said, I'm moving into my own apartment. If I start crying here, it's because I'm so proud of the woman. So she moved into her apartment with her son. And I called one evening and said, I'd like to come over and see your apartment, say hi, do you want me to bring dinner, do you want to go out to? She says, no, I want to make dinner for you. So keep in mind, Tina's in a wheelchair. She does get up and stand here, and I'll explain our exercises here. So we worked on her standing skills, her walking skills, her movement skills. So I arrived at her house for dinner, and I found out that she had spent the entire day cooking. And we sat down to a wonderful dinner of lasagna that she had made from scratch. So to get their independence back, does it work? Yes. How does it work? I don't know. I know it works. So this picture is here. Tina started walking with us without the walker. We were just letting her just move her feet. And then when she came to me a few months ago, she said, I just want you to let go of me and let me walk. And I said, well, I can't let go of you until you can stand. So we practiced, I don't know how many times we practiced, over and over and over. And it looks really funny that I put Tina in the corner. But we practiced, and that final picture here, that is Tina standing independently without any support around her. It looks like she's leaning up against the wall, but she's not. She's actually standing independently. So again, their bodies are not broken, but it's always looking for information. So it's the information that I'm giving them. I'm giving the information about positioning. I'm giving them the information about movement. I'm giving the information about close your eyes, visualize it happening. And we've seen a lot of results just from those patterns happening. So that's the methodology, if you will, that I'm right now using. This is Diane. Diane was an executive actually with airlines, and so she was very busy, very active before that. She and her husband used to hike a lot. They used to travel a lot. And one of the things that we talked about when I just first met her, we got back together again about 3 months ago, was that she wanted to hike again, and she wanted to help out more around the house, which that's pretty big for a stroke survivor because they don't usually have the motivation to get up and do stuff. So I told her, well, the hiking we'll work on, and we're going to work on you working around the house. So our first go-around was to try to help her learn how to make the bed, pull the covers up. Then she wanted help set the table. I said, great, let's do that. So one of the things that I encourage with these guys is we're going to use both hands. Her right hand is not functioning as well as the left hand, but we made her use both hands. So after about 3 weeks, her husband came to me and says, I don't know what you did, and I don't know what you said to her, and I don't know what practices you're doing, but it worked. She is now making the bed in the morning. She is now setting and clearing the table using both hands. She'll pick up the plate with both hands. She is also folding clothes, so when the laundry comes out, her husband no longer has to fold the clothes. So she's very, very active now at home, and he came and said, I don't know what you did for the motivation piece, but she's actually asking me, what can I do next? So the hiking piece we worked on, and I told her the only way you're going to hike is to balance. So this is one of our balance activities. And for anybody who's actually done this activity, try this at home. Put your weakest foot behind you and stand with the other one in front, and then close your eyes and tell me where you go. So Diane, we do this every single day when she comes in, and we do it for about 45 minutes. She's gained more balance, and I'm not holding on to her, so you can kind of, now the video stopped, but she can actually stand in that stance without any assistance. So next year, I expect to see her actually going out and getting into the hiking scene. So the other thing that we provide and what stroke survivors need is speech, reading, spelling, word recognition, letter recognition. So we have a speech therapist. They work with speech therapists. And I'm so thankful for technology because the technology that we have nowadays can help these guys hear, see, and listen and know what they're doing. It will record their voices. They can record and over. They can see their face move. They can learn that. So the picture on your left, that's Phil. Phil was a salesman, and he's about 74 years old, and he has apraxia as well as Rudy on the other side. So they have problems forming their words, and they also can't find words. So we work very hard when we're exercising. They're always saying sentences. They're counting. I'm asking them questions that they have to respond to, because we also know and have found that as they're doing cardiovascular exercise, their speech actually becomes clearer, and they have less word find issues. So we practice this all the time, and you'll see the two guys working together. And that creates that social interaction that we love to have because that's what they need. So they get socially active, and they also challenge each other. So there's this little challenge thing going back and forth. Because one of the things I did find that if we challenge them, they will rise to the challenge. And I've seen it happen over and over and over. And if I don't challenge them, they're just going to sit and do nothing and wait for me to tell them what to do. But if I challenge them and say, go get this done, do this, they will get up and do it. So Rudy, he's in the red shirt there. He's my poster child. He works and works and works, but he has a very analytical mind. He analyzes everything, including watching my mouth move when we do speech. He will look at me and watch me until he can get the movements with his mouth. So Rudy started working on speech and call it making phrases, but you'll see in the next video here that this is his word find. So say flamingo.
Lingo. Ling.
Fla.
La. La. Mingo.
Put it together.
La. Mingo.
Got it. So we were practicing the word flamingo. So you can see him put his finger up here. It's like, wait a minute, let me look at you, let me do it again. So he's trying to say flamingo. So we start out saying the initial words, and then when he finally gets it, you'll see he gave you a thumbs up. Okay, so the next picture that you see, I had my camera going when he came in the morning, and I said, good morning, Rudy, and he says, good morning. How are you? And I said, I'm fine, thank you. How are you? And he says, I'm fine.
Morning. How are you?
Fine, thank you. How are you?
Fine.
So he went from learning to say flamingo, which is fairly hard to say, to phraseology of being able to say good morning. He also had some voice inflection happening as well. So that was really impressive to see the change in him in less than 90 days. He's been working on his speech a lot. So one of the reasons these guys do recover and they can rebuild their lives is because we need to give them hope and motivation. So one of the things that we talked about when my clients first started with me is that I don't have any motivation to get up and do stuff. Why should I? I'm not going to get any better, so why should I? And given the things that they've been told over their time of recovery, that would be possible. So one of the things I really try to do is instill in them to try to give them some hope that they are and will get better.
In the last 90 days, Rudy's progress is nothing short of miraculous. Frequently, family gather at Rudy's brother's home. Once, I had forgotten his walker. He leaned on his sister Rose from the car to the backyard. This act shows greatly enhanced balance and stability.
So that's Rudy, and Kathy, his wife, is actually here today. So if you have questions, she'll be here after the show. You can actually talk to her about how Rudy has improved. So with motivation and hope, these guys are generating the results that they want, that they desire to have. So I give them the challenge, we give them the positioning, we give them the plan, we give them the repetition, but we also give them hope. And their hope is restored. And once they begin to have that hope restored, they actually start taking an active part in their own recovery. They're asking me, what is next? What can I do now? What can I do at home? And I never heard that from them 3 or 4 years ago. Now I'm hearing, what can I do now? That's motivation. So they have the hope and the motivation coming along with it. And you met Tony earlier, and this is part of his story about his recovery.
Some of my therapy, I do painting in my artwork. I use acrylics, and I also use chalk type medium. And I continue to improve.
So that's Tony. And he's been doing his artwork now for about 4 years, and these are 2 pieces that he has given to me, and he's wonderful. So again, just because they don't move like we move doesn't mean that they don't want to live active lives, because they do, and that's evidenced by seeing them out with their family. And just because they don't talk doesn't mean they don't think. And that's the one thing I think is really critical to most folks who encounter stroke survivors, is just because they don't talk doesn't mean they're not thinking. They're all really, really super smart. We have fun. We took the guys bowling. This is our Halloween. They do live active lives. And as I mentioned before, Don and Dave, two of their goals were to ski and to drive. Well, ladies and gentlemen, here they are. Bye.
Bye.
Notice which leg went in the car. That is his affected side.
Yeah.
You did good though. Look at that.
And this is Dave.
Bye.
So they're driving. Dave just got back from a 4-day trip up to Cortez and Steamboat and one place else, and he went all by himself. So they do live active lives. Just because they don't move well, they still can live. And again, Diane, you met earlier, and Phil, these were a few years ago. So with the balance piece that Diane and I were working on last week, she gave me a wonderful gift. So we were practicing our balance, and we have good old Frank Sinatra playing on the radio because we play music all the time we're there. She started dancing. Started kind of moving her legs, moving her arms a little bit, kind of dancing away. And I said, "Do you dance? Have you danced?" And yes. And I said, "Let's dance." So I started kind of walking with her and dancing with her, and she completely blew me out of the water. This is how surprising they are to me. But after we started practicing, her husband came to pick her up, and I said, "I want to see you two dance." We were working on today. And see the smile on her face? She's excited to do something that she didn't think she could ever do.
Keep going, you two. No, just a couple minutes. I want to get your feet. So I got to
They've seen her pick her feet up.
picking up. And her body moving. There we go.
So as you can see, these guys do recover and they do rebuild their lives. So the recovery for stroke survivors, recovery is living, is getting their lives back. That is what their recovery is. So that's why I completely believe that every stroke survivor, given the chance, given the structure, given their motivation, and given them hope, they do recover their lives back. So thank you very much. I appreciate it.